Hi, I'm Sarah and I'm an EFDA at CVPD, and I'm going to be talking a little bit about treatment and restorations. The most common question that we probably get asked here is, why do we need to treat baby teeth if they are going to fall out anyway? We want to keep the baby teeth in the mouth as long as naturally possible so that they exfoliate on their own. And this helps with many different things. It helps them to be able to eat properly, it helps them to be able to speak properly, and it helps them to be able to grow their mouth and their jaw correctly. If we lose teeth early, it can also cause space loss, which can also cause issues with the permanent teeth that are erupting and cause issues in the future with that as well. Baby teeth are much more porous than permanent teeth, so for that reason we do have to treat them a little bit differently, and cavities can also get larger very quickly. So when the cavity kind of reaches that enamel or that outer layer of the tooth, that's when typically we can kind of monitor it with good hygiene at home, and keep an eye on things. We might take x-rays a little bit more frequently just to make sure that they're not getting bigger, but treatment isn't always necessarily needed at that time. Once they reach into that dentin portion of the tooth, that's when, okay, we need to start talking about treatment. Whenever we are kind of starting to talk about smaller cavities, then typically we can talk about like white fillings and things like that. But once we start talking about the cavity getting onto multiple different surfaces of the tooth or getting a little bit larger into the dentin, that's when we have to talk about stainless steel crowns versus fillings. We'll typically recommend stainless steel crowns over white fillings to prevent pulp irritation or recurrent decay causing in larger restorations or issues in the future. And then when the cavity is getting very large or closer to the pulp or even into the pulp of the tooth or that inner portion, that's when we have to talk about possibly doing a baby root canals or even in worst case extractions, either to avoid abscesses in the future or to remove the abscess that is currently present. Because treating baby teeth are so different than treating permanent teeth, we do recommend that you see a pediatric dentist who specializes in these treatments to get the best care for your child.